Bihar, one of India's most populous states. Every childbirth is a race to save mothers and their newborn babies. The state's maternal and neonatal death rates are heartbreaking. But most of these deaths are preventable with basic hygiene at home and updated medical practices at the primary health center. Amanat, the nurse mentoring program, has at least 2 nurse mentors at each primary health center. They are at the facility to give extensive training to the auxiliary nurse midwives who work here.
The baby is moving. Heartbeat is 130.
The midwives here, we train them thoroughly. Before this, they didn't even know the basics of hand washing or how infections spread.
Earlier we used to just wash our hands, but not methodically for 20 seconds.
The midwives are trained through a total simulation of a labor room, so they learn exactly what to do in an emergency.
Earlier we used to tie the cord with a thread and cut it with a blade. But the Amanat training taught us that this could endanger the child's life.
Age-old practices and traditions are being relearned. Barriers are being broken progressively.
Earlier, postpartum hemorrhaging cases were sent to the district hospital. But now the midwives know how to recognize and treat PPH cases right here. During the training, we've also taught the midwives about exclusive breastfeeding.
Over the past 2 years, stillbirth rates in these sectors have reduced from 19 per thousand to 14 per thousand. Clinical processes have significantly improved. Birth complications were quickly identified and referred to the district hospitals after stabilization.
Midwives here are much older. In fact, they experience as much as our ages. Initially, we had some problems, but then we saw how enthusiastic they were to learn. And it's wonderful to see how well they respond to us.
We've been able to save the lives of so many mothers and babies. It feels really good.
garabha